how does that relate to the portal?
Around that time, this is years ago. This is around 2008, 2009, around that High Tech Act,
Yeah.
where there's that big push for interoperability, but there's less focus on patient portals. But it was there doing that field work. I understood that perhaps if people had more access to their records in their pockets, how would it change the way they facilitated discussions with partners about testing? When were you tested? Could you show me your results? Could you share these results with me?
Hello, and welcome to Informatics in the Round, a podcast designed to help everyone become a part of the dialogue about topics in biomedical informatics. I'm Kevin Johnson, physician and informatics researcher at the University of Pennsylvania at KBJohnsonMD on Twitter and www.kevinbjohnsonmd.net on the web. Our special guest today is the man who started off this episode, a young faculty member from Johns Hopkins University School of Medicine. Kevon-Mark Jackman is a Dr.PH and MPH and an assistant professor in pediatrics and adolescent medicine. We met a few months ago, and I thought it would be fun to discuss some of what he's doing with electronic health record patient portals with our group. Sarah Bland, you know, she's a leader in Vanderbilt's Center for Precision Medicine, and she's here, as is Jane Bach, an extremely successful performing songwriter in Nashville. Jane is joined by Jeanie McQuinn, a partner with Jane in songwriting. They go back many years. Jeanie was actually a huge fan of Jane's and actually is somewhat afraid to meet her, as you'll hear. But they now work together from time to time. You'll get to hear from all of them discussing Kevon's work, as well as work that still needs to be done to improve the use of patient portals. Hope you enjoy this episode.
I said, I don't remember that particular episode, but I did watch the Flintstones.
Well, I've watched every episode, so that particular one is the one where Anne Margaret, playing the role of Anne Margrock, sings a lullaby to Pebbles.
Oh,
It's called The Littlest Lamb. You should look it up. It's very pretty.
almost, no.
Yeah. And of course I have like two other major lullabies in my head. Let's see. So Kathleen Battle on her album did Fe Do Do Piti Son Mama. It's this beautiful little French lullaby. And then what's the one that oh, Chitty Chitty Bang Bang. A Gentle Breeze on Hushabye Mountain. Remember that one?
You know, I don't. I certainly remember Chitty Chitty Bang Bang, but
Oh,
I don't.
well,
I at times have so much crammed into my head that musically, so much music crammed in there
yeah.
that seriously, I mean, I can remember something I wrote 40 years ago, but I don't always remember things like that.
Well, that's
So,
okay. Well, I've done nothing really important, so all I remember is things like that.
yeah.
So, anyway.
I would like to share my favorite lullaby
Well,
that
please do.
well you did that French one, and mine's not as refined sounding by any means, but when I was little, my grandfather, he would sort of sing but also just say, the raccoon tail goes round and round, and a possum tail is bare, but the poor little rabbit, he ain't got no tail, just a little ball of hair.
We could put that to music.
Yes.
So, Kavan, do you have a lullaby since we're all sharing these
These
lullabies?
lullabies are not
I unfortunately do not.
What?
I do not. No lullabies over here.
Uh,
I think what we got was go to sleep.
Don't get active again.
yep. So, everybody, welcome to another episode of Informatics in the Round. I've got a great group of people here. Let's see. Kevon, who are you?
My name is Kevon Jackman. I am an assistant professor in the Division of Adolescent and Young Adult Medicine in the Department of Pediatrics at the Johns Hopkins University School of Medicine.
Well, good, good. Sarah, who are you?
I am the Sarah T. Bland. I am a senior project manager in the Department of Biomedical Informatics at Vanderbilt University Medical Center.
T, huh?
Sarah T. Bland.
That's a first. What's the T
Are
for?
we allowed to ask what the T stands for?
Get ready, Timberlake.
Oh my God.
Yep.
Were your parents hippies?
No, it's a family name. The Timberlakes, Virginia. Yeah. So my ancestor, John Timberlake, was one of the guards for John Smith back in the day when they came over.
Wow. You mean what's her face is John Smith?
Well, that's not true. They
Oh.
never met. Disney ruined us all.
Yes.
I couldn't think of her name.
But if
Pocahontas.
I'm related to Justin, yeah, sure, probably. But my family got here first, so
There it is.
There you go. Wonderful.
So Jane, who are you and who is your guest?
I guess. My name is Jane Bach, and I am a songwriter here in Nashville. That's me. And this is someone that I work with, Jeanie McQuinn. And Jeanie is here because we happen to be writing today. We're working on a project together, and I asked her if she would like to stay because these are always so fun.
So Jeanie, how nice to meet you, first of all.
Thank you.
And how do you know this woman?
Oh, I've been in town for 10 years and I knew who Jane Bach was before I ever moved here as a songwriter and
Yeah.
icon to me, you know. And the very first round that I went to at the Bluebird Cafe when I moved here, so we figured it out. It was like the end of October. 2012. It was Jane's round. And I was like, holy cow, that's Jane Bach. Okay. And I was too shy to meet her that night. And then I heard her again in another round at another place. You know, so
And she didn't come up to me then
I
either.
didn't, I was too shy. But at a mutual friend's Christmas party, this was 2 years ago.
Yeah, 3
Yeah.
years ago.
I was like, I'm gonna talk to her. She was, you know, she and her husband were there, and I flirted with her.
Yeah, she flirted with my husband, and then
Well, you were talking, so I was talking to him, and
anyway, we met and became friends
Very
and
good
started
friends.
working together. And Jeannie also runs a publishing company, and
What's the name of your publishing company?
Great Big River Music.
Okay, I'm going to
My
need
late-
you to send me a link to that so I can put it in our notes.
My late husband
Absolutely.
was my publisher, so I inherited that from.
Okay. Cool. Jane, some of the people here that are listening will not remember why we've called this Informatics in the Round, but it was just brought up. So can you just say a word or two about what this round is?
right in Nashville. Well, actually now everywhere, but I will say that it started in Nashville. Being the home of music, it's Music City. There really was not a home for songwriters to get up and perform their original work. It just really wasn't done, unless you were a singer-songwriter who wanted to be a performer. But at that time, back in the very early 80s, there were a lot of us that were just songwriters. And a woman named Amy Kurland opened up a club called the Bluebird Cafe. And she put together this idea of a writer's round. And a writer's round has 4 people in it generally. 4 people, and you literally sit in a round, and you only do original music. You don't do any covers. And that is the one rule. And you go around, from person to person and then back again. Generally, you get to do 4 or 5 songs each. And again, they're all original. And in Nashville, what you find is, like myself, I've been very fortunate to have had some hits. And so these are songs that people recognize. And there are always stories behind the songs, and they love to hear that. So it's fun. I really enjoy doing it. I never thought I would enjoy performing because I'm not a great singer. I'm just a writer. And so I am called a performing songwriter. And I just love it. I love doing it. I just really have a good time with it. So I'm not exactly sure I even remember. Was it with me that you started calling it around, or was it before, and that's why you asked me to do it?
It was before. We actually had a naming contest in episode 0, and a number of names came through, totally informatic. An informatician walks into a bar, and the one that won was Informatics in the Round because it was explained just the way you did that. And the only thing that you didn't say that I've heard people say is that it's also a part of the round culture that the other 3 songwriters chime in either with harmony or
Oh,
sometimes
yeah.
with the egg or something to
If
kind of.
Yes, if they know the song, if it's a song that everybody knows. And also the generally when you do a round, you're doing a round with your friends. So you're doing a round with people that you work with. So a lot of times you'll be doing songs that you wrote with somebody else in the round. So yes, there's a lot of interaction, and we all do know each other, hang out together, work together, and so there's a certain camaraderie there. And the most important thing for me is that the people in the audience love it. They really do. They enjoy
Yep.
that camaraderie and the stories and everything. Anyway,
So why that turns out to be the perfect segue is because the topic today is actually about patient portals and what works with them and what doesn't work with them and how they can be used to help healthcare. And I stumbled upon this topic when for 2 previous episodes we talked about this whole idea that patients can now see their notes and patients can see their lab results and how will that go. And what we heard was basically it went very well. There was essentially radio silence. So Kevon has asked me to be a part of a group who are going to be mentoring him as he studies something that relates to patient portals. And I thought it would be fun to both hear what his desire is, but then also to hear what all of your desires are, because they may actually be things that we can all talk about as if it was a round. So I was so excited.
Nice.
get
So,
it?
yes, that's right. High five. There it is. Hey, can I do that? Let's try this. Wait, I guess I'll get the video. Everybody, hands up. Let's try this. Ready? And high five on 3. 3, 2, 1. High five. There it is. Oh, good. I'll take a picture of that from the video. That'll be good. Okay. So, Kevon, tell us about what you do and why patient portals matter to you.
Right.
And everybody ask questions because he's going to undoubtedly say something nobody understands. So I'm just going to sit back and watch you guys take over. Go ahead.
Right. Oh my goodness. So this question is often troubling for me because I don't know where to start. But I will start with um, my work as a disease intervention specialist in Miami-Dade County. I went around notifying individuals within their STD prevention and control program, notifying residents in Miami of positive tests for chlamydia, gonorrhea, HIV. And what I saw, what was most notable were the new positives that were young people, teenagers for HIV. And we'll do this thing called partner elicitation or contact tracing, as has popped back up as a term with COVID, where we try to identify exposures so that they can be referred in for testing. So if someone's any positive, we find out who've been their sex partners within the past year. So the younger folks, 15, 16, 17, they would typically report like maybe 1 or 2 partners, but this one partner would be much older and have been post-test counseled for HIV years ago. And that
So
was
wait,
typically,
what does post-test counseling mean?
Yeah.
yeah. So post-test counsel, many states have laws as part of prevention and control for HIV because we want to make sure, number one, individuals are aware of their status, and once they are aware of their status, they're also linked to services. So if our laboratory and HIV is reportable, so it goes to the state, the state kicks it back to the local healthcare system to make sure that whoever received that positive laboratory result are in fact aware of that positive laboratory result. So this could happen at a doctor's office. Often it's referred to the health department. The health department sends a disease intervention specialist, which was yours truly, to the home of that individual. And we'll talk, we would notify the individual of their positive HIV tests, or they'll come into the clinic. As you can imagine, it could be a heavy conversation, but we just reassure that there are medications, and many people live healthy lifestyles. I would often say healthier than me. and um, but we'd want to make sure that they know where to get those services, who are reputable HIV providers in Miami-Dade County, as well as social support, and a host of other services. So that comes with this whole post-test counsel. And another part of that is saying, okay, so within the past year, whom have you also had sex with? And the purpose of that is solely to ensure that those people are referred in for testing, so that if they, are positive for HIV, they can also get similar services and also receive similar education. So it was in that process in which I noticed this trend, and that's called a post-test counsel. And which also ties into receiving results. When there was a talk about patients receiving electronic results before a doctor could give it to them. This was one of the topics that was brought up is conditions which could bring about psychological distress and the risks of that, and whether it's a risk of not having that sort of support there with you, as opposed to just viewing it on a laboratory result. There's no one there to talk to. So that was an interesting discussion. But that
so how does that relate to the portal?
So around that time, this is years ago. This is around 2008, 2009, around that High Tech Act.
Yeah.
Where there's that big push for interoperability, but there's less focus on patient portals. But it was there doing that field work, and this is why I appreciate working in the field and then taking it to research. I understood that perhaps if people had more access to their records in their pockets, how would it change the way they facilitated discussions with partners about testing? When were you tested? Could you show me your results? Could you share these results with me? As opposed to just taking someone's word for it. So my research around patient portals started really about asking those questions and trying to understand how people even felt about that idea, about discussing and sharing and disclosing test records using patient portal.
So let me ask you this, because when you first told me, I can imagine Jane. I know how much Jane loves privacy issues. When you when you first told me that there were people who would actually, pull out their portal potentially and show their test results, or at least would want that, I was shocked. I'm sure you remember, because my thought was I didn't know anybody would be that forward. But you're telling us that there are patients who are both comfortable with this and who might even expect it?
Right, and there are people who have done it, anecdotally, that I've spoken to. But there are huge issues around privacy. How is this done? Are you showing me physically in real time? Are you sending me a screenshot of something, or a picture of something, which could bring about other issues of privacy? So this is what I would say, it's still a burgeoning area. I haven't seen, although there are several private companies that focus on disclosing electronic HIV and STI test results. you don't really see a lot of recommendations from physicians or providers or guidance on how to even safely facilitate these conversations.
Wow. Jane, I know you're thinking something.
No, I just, I know that we have a portal. My husband went through cancer, and we set up this My Health portal thing. And when I knew I was going to do this this afternoon, I went and I looked, to kind of see what was going on there and what. And I mean, there's a lot of information on there. And it even had, he has his 6 month procedure on July 11th. Now,
Oh,
coming up, yes. Now, I have not looked at this portal until today for quite a while, actually. He's been cancer free for 2 years, thank God. And so, yes. And he does go through these. It was every 3 months, now, every 6 months. And I looked at it and it had new information on it. It also had his upcoming appointment. And I mean, I was like, whoa, I mean, I haven't looked at this thing, but it's obviously self generating.
yes.
And what I had mentioned in my email, just very briefly, was it does. I have privacy issues. It's scary. I understand. I think it's necessary as a patient. I want that information. There's nothing that used to make me madder than when I would ask the doctor for something and I couldn't have it. It's mine. What are you talking about? I can't have it. That's mine. It's about me. But I digress. So anyway, I just felt it's a two-headed coin or whatever the expression is, because yes, as a patient, how wonderful to be able to access that. As a privacy issue, it scares me. I had my identity stolen 5 years ago. Sorry, 7 years, 2015. And I mean, they stole everything from me. They
So wait, how
stole
do we
money.
how do we know that it's really you now?
Exactly.
Yeah, I'm Jane Bach.
It was horrible. And it was, they don't know how it happened, but
Yeah.
they finally tracked it down to where it came from, believe it or not, in Russia. And well, there was some sort of something where they were, you know, just reaching out through the net to everyone's computer. I don't know, but they did. They got. It was horrible. Anyway, so that scares me to think the information they got was all financial. They got into my bank account. They got into my credit cards. They got into, that's all financial. But what if they had accessed real personal information about me, my medical information? If I worked in an office and I needed to go get another job, can they do that? I mean, can they access that information? And is there something in there that's going to prevent me from being hired? I mean, it's scary.
But on the other hand, we just went through the pandemic, and I'm not going to pull up my phone here now, but to Kevon's point in terms of his project, if I were to go to my phone and you were to say to me, "Can I just see that you're vaccinated?" We actually have an app. I mean, in your portal, it shows that you're vaccinated. Does that freak you out, or is that okay? Because that's
Oh,
closer to what he's trying to do.
I'm vaccinated and boosted. I don't care. I have that on my phone, and I also have my card laminated. So I mean, it's in my passport because I travel a lot. I do have to have that information with me, and I have no problem with that at all. That's not the kind of, and truthfully, I can't even imagine any information medically that they would get that would be, a problem for me or for Gary at our age. I mean, I just can't imagine it. But I would imagine if I were younger, that might really be something I would question.
But what you're
Yeah.
hearing is that the younger group seems to be even more possibly okay about this, right, Kevon?
Is that interesting? Well, it's a different
Yeah.
generation.
Yeah, it's and you're right. It's different types of privacy breaches, that kind of concerns folks. It's, for example, somebody may be, I guess, first starting off closer to that, hacking. We do recall cases where there have been ransomware attacks on health systems where hackers have hijacked and even shut down here locally in Baltimore. I believe it was I don't want to mention any names, but a hospital system hijacked their records. They had to go offline. The same thing happened to the local city government, where they had to shut everything down. So we're living in that age where, there are a lot of resources generated or directed towards cybersecurity. When it comes to like sensitive matters, sort of like health, HIV, sexually transmitted infections, there's a lot of fear about secondary disclosures. So if someone now knows that you're living with HIV, will they, will they share that information with someone else?
Uh-huh.
Is that something that's created by sharing via the patient portal? Not necessarily, because people had disclosed that information before, just word of mouth, and there's also risk of secondary disclosure there. Um,
That's the
And
next thing
abortion,
that's the next thing that is
Yeah.
obvious,
Yeah.
so freaking upsetting, is that information. I mean, I read, and this just blew me away. Of course, I'm old, so I don't deal with this anymore, but the young women, they have period trackers on their phone, and they're going to be accessed. Are you kidding me?
Yeah.
It's horrifying. The whole thought of it is so, it makes me shake.
Yeah,
Horrifying.
that's actually what I was thinking about a little bit more is that, with the news of Roe v. Wade being overturned and living in Tennessee,
Oh,
um, things like period tracking and even abortion status,
absolutely.
or even pinging a location near a Planned Parenthood, where those privacy lines are is going to be interesting because we know that there are states that are willing to try to find some way to criminalize even crossing borders for a woman to go get a safe abortion.
Yeah, that a woman now is going to have to, they said in Texas, they're going to do it. I don't
Yeah.
know if they can truthfully and how they can enforce it, but that you're going to have to show a negative pregnancy test if you want to leave the state. What are they, nuts? I mean,
Yeah.
it,
so,
That's why
so
I think we need to just cut that state off and let
it's
them.
ludicrous, even though it's ludicrous to
somebody's
enforce something like that. The thought that they would even mention it, that they would even think it up, is horrifying. I don't want to go there. I
right.
can't.
So, so I should say, just within the scope of the research that I do, I'm the only thing I really focus on self-disclosure. So somebody's willing, free of coercion, decision to share information with a trusted partner, with someone they're willing to share this information with. Any sort of unauthorized access is not cool. It's not okay.
That's fine. This is interesting to me for a number of reasons. One is that I do a lot of work in our patient portal as far as the family history goes. And we do a lot of messaging with our patients back and forth and through the portal. Do you find that there's a particular population or group? You mentioned the age thing, but I could see this also being helpful for LGBT communities as far as STD disclosure and HIV disclosure. Are you seeing that with the research you're doing?
Yeah, so in 2018, I got to add some of these questions to the American Men's Internet Survey, which is a nationwide survey among gay, bisexual, and other sexual minority men. And we did see overwhelmingly, I think, upwards of like 90% were willing to share with main partners, closer to 76% willing to share with non-main partners and disclose these online results. We saw differences by age. Younger participants tended to be more willing to use their patient portals for exchanging or showing test results. And we also saw differences by the participants who were living with HIV. participants living with HIV by proportion were less willing to use patient portals for disclosure. Um, so that is something that was noticed as well in terms of differences by groups.
So why do you think that?
Stigma.
Ah,
Yeah, HIV. There's significant stigma still living with HIV, and I as a part of another research project, I speak with youth who are living with HIV, and one of the topics is disclosure, and it's still a big concern about folks are not educated. Society, we're still living in a society where people make jokes about living with HIV, say very insensitive things on TV, on media, and this all impacts you know people who are living with HIV, and it helps to build that stigma where it's something that um, you need additional supports and a good strong sense to be open and to share that information if you want to, or if you choose to, with individuals.
The interesting thing is, at least this is what I believe, and I could be completely wrong, is the more open we are as a society, the less stigmatic things are. That the only way you can rid stigma from something is to enlighten it and let the sun shine on it.
Absolutely. And what's interesting about this whole issue of stigma, something else we could cover at some point, um, there are communities, for example, who are very open about people who have mental health disorders. And what they're finding is that the more transparent and open people are about mental health disorders and educating people about them, the less stigma there is, and the more resources are provided to help them to get into situations where they might be safer. So, what amazes me about this topic is I don't think any of us, maybe Sarah, because she's progressive, but I don't think any of the rest of us would have imagined that there would be a population of kids who say, look, you want to know about me, here it is, and use the portal in that way. So I'm applauding him for studying it. But I also want to ask you guys this question. So, because what I've learned from Kevon is that there are ways people think about using the portal that I never ever imagined. And as one of the people who has been a big proponent of the idea of patient portals like My Health at Vanderbilt, I'm curious what you would say. So Jane, I'm going to put you on the spot.
Uh-oh.
Jeanie, I see you're up there. Go ahead, Jeanie, you go first.
When I'm looking back at my blood tests and things, I don't know what CPMH means, and I do like to look back and see if something has gone up or down. I mean, I know what the bun is, or your cholesterol, but I don't know what all these other combinations of letters are. So if
Well, because in some cases, it doesn't matter that the information is up there. I don't know what it means.
Yeah, they
So,
can explain it.
So you'd like the portal to explain itself better.
yes,
What is
it's
this?
very good, Jeannie,
What
because
is
I've noticed
okay?
that.
What is this blood test thing? What is it?
yeah.
I don't
Yeah,
know.
I mean, is this good or is this bad?
Yeah, I don't know.
That's another thing. I don't know. Sometimes when I read it, I go, well, should I be happy about this?
CPMH is actually easy. It's how much of Jane Bach you've turned into an identity you've stolen.
It wasn't me, it was her.
It's a low, normal, high. Well, if it's high and it says maybe 7, but geez, what's the highest? How bad is it?
7 out of what?
Yeah, 7 out of what? That's what
It's just more information, I guess.
Well, that's good though. I'll tell you one thing that your portal can be used for that people like. If you're actually out of state and nobody can get to your records, you can actually delegate your entire record through the portal to them. So you can say, go online to this website and you can see my entire record. They get like a one-time use access to your entire record.
See, now I didn't know that. Why don't they advertise that? I'm out in LA quite a lot. I live there like 5 months.
I understand.
Whatever. But it'd be great. I've had situations where nothing medically crises that way, but like with my eyes, my most recent prescription, and I didn't have it. I don't know access it or anything, how to call the eye doctor.
It's in there. It's in there.
and that cuts down on time too.
Yeah.
In terms of like getting those records if you're out of state,
Great.
cuts down on time. Yeah. I but I think that has always been a challenge, like this translation of medical information to the patient. I'm not a physician, but I would imagine that physicians have, that's always been an art, is communicating information to the patient in a way in which the patient understands and it's digestible and they can make use of that. And I think the same thing is true with the information that's within the patient portals. How do you translate it? How do you diffuse it in a way in which it's can be understood by a patient who is 15 years old in Baltimore City, 36 years old, in North Carolina, or
Right.
it's 67 in LA, So it's a challenge, and I think there's lots of room for growth and exploration in that area.
Your next project.
Well,
So,
some sort of glossary almost,
Yeah.
where if I were to read something, I would go, well, I don't know what that means. And I could just go to the glossary and look it up.
yep.
Yep.
Okay, we'll take care of that. So, Sarah, if I asked you, I'd like the portal to blank, what would you say?
Um,
G-rated.
I've thought a lot about this actually. One, becoming a parent and having access to Bradley's portal has been really nice because I can send his doctor messages and everything. Also, keep track of his appointments. It was really nice too because he was actually born at Vanderbilt, so I have all of his vaccination records in there.
Hmm.
So when we enrolled him for school, that was great. Actually, I do think it would be nice to be able to track trends. It would be nice to be able to look at like my cholesterol over time and see how it's changed, from 6 or 7 years ago. So that would be a really cool thing. I think though, what I would really love is a better way to add old information in from other doctors. Like I've lived in 6 states,
Jeez.
so I have hey, don't hate on that. I I have a doctor that I went to for a few years in Georgia, and they're not
Oh
on
my
Epic,
God. I'm sorry. Sorry.
and I survived somehow. So this provider doesn't have Epic, so I would have to like go to that provider's office, print out all the information,
Yeah.
and then bring it back and scan it in. Same thing with like my vaccination records from when I was a kid. It'd just be really nice to not just have those as PDFs, and it'd be cool if it could digest that information and then add it to the culmination of everything.
I wonder how many patients wonder about those things. I mean, I've heard many people talk about the fact that they don't understand the numbers. And I'll tell you that what we've generally been able to, how we've reassured ourselves as healthcare providers is that the patients who don't need to know the numbers or don't understand them stop trying to figure out how to use their portal that way. So they don't call us because they stop looking. That's what you sort of heard
Mhm.
that when Will was talking about in one of our episodes when he was talking about illness that he had. He mentioned that he just stopped looking at when he got notifications about tests. He waited for his doctor to call him. That would be Friday, November 12th's episode of 21st Century Cures. What song are people singing? Now back to our show. Because he knew he wouldn't know what it was when he saw it. That's one end of the spectrum. The other end of the spectrum is the people on this call who actually generally do know enough medicine to kind of get themselves in trouble. So they want to get into it and look at the data and figure out the trends and 7 out of what and all that. And they should have a way to. I was actually looking. I pulled up my portal here because I wanted to see. Here's our portal. You can't. Oh, you can't. Let's see. There it is, right there.
There
I
you
was trying to see if there was a way that it would explain the test to you, and you're right. I thought if you touched the right thing, it would tell you. It never does. You're right.
Some of them show ranges, but not a lot.
Yeah.
And as you're saying that, Kevin, I'm thinking about my kids' portal, and we do
Ranges.
track trends, but it's usually only for young ages and then older ones. Like Osteoporosis. We'll track that information, because we want to make sure that people are not getting stronger osteoporosis, and want to make sure we're tracking that. We also check Bradley's growth chart, as he's younger. But it's like this middle ages of, after you become an adult to once you start to become decrepit. We don't track anything.
That's
I just
right.
wanted to say decrepit.
I know you got it in
You
there.
don't get-
Kevon, how much, so since you've already heard from some of the patients that they don't know what things mean, is that going to impact your studies? Is that something you're going to have to fix?
Yeah, it's certainly something I'll write about, and and try
That's
to.
a clever academician's way of saying I have to stay focused so I can get promoted, but I'll add it. I'll put it over there someplace.
Yes, but I do think it is a noteworthy challenge to understand how patients are interfacing, and then how can we, make it better for them. So it is something I'm hoping to address in my future research, and make these tools a little bit more functional for different demographics.
There you go.
Do you see it connecting with other apps that maybe are a little bit more like uh, friendly, like Apple Health, for example?
Hmm.
Our My Chart app connects with that. A lot do. But are there ways to connect in something that's a little bit more patient friendly or person centric that could make our portals a little bit more easier to understand and have digestible information?
Yeah, I think there are different approaches that can be taken. Certainly with um, like the infrastructure that's been created by legislation, more of these companies that are focused on like user centered design, user friendly interfaces could work with data from the EHR system to create things that specialize and that focus on the end user. So I think more of that is happening, and I think there's more room for that. But are EHR companies or patient portal companies, are they working on making a user more user-friendly interface for patients? Certainly, I think maybe a decade ago, people were less hopeful of that. But if just anecdotally speaking, from the changes that I've seen in my chart, they've come a long way.
Yeah.
It's still a headache, for a lot of people, but they've come a long way.
Jane, you talked about how you hadn't visited the portal in a while. So back in
Yeah.
2016, when Vanderbilt had its portal, I used to get constant badgering from my boss about when are you going to make this thing as easy as OpenTable? That was the conversation. It was, I want to schedule something. I want to just be able to go and say, I want to see this doctor at this time. And now we have that. But it's because the company that made this was actually quite a bit further ahead in terms of providing it. One thing we don't have, anybody here have an Apple Watch other than me?
Yeah, it's in the other room, but I,
Don't you wish that the data from the Apple Watch could go into Epic?
well, doesn't it?
No,
Where does the data go? Does it go anywhere?
into your head, along with all that music.
It does go into my head. Does mess with me sometimes.
No, every so while, because my doctor will say things like, "Are you dieting and exercising?" And I'm like, "Can you see my screen?" And the answer is they
Yeah,
can't.
my activity tracker.
Right. I got to close my rings, but they don't see any of that.
Yeah, man.
You're right. That information doesn't go through, even though. So I want to clarify. When I said that my chart is connected to my Apple Health, it is, but it's only that my chart will send stuff to Apple Health. It's not the other way around.
Of
Right.
course.
So it would be nice if it was bi-directional.
Yeah.
The other thing that would be nice is while I'm connected to my son's portal, it's not my portal's not connected to my other family members, and so it would be nice if if let's say my mom has a heart attack, there's some way that my mom's health condition can notify my portal that can notify my doctor.
Ah,
This person is probably at a higher risk now for cardiology event or cardiology issues. So, you might want to put that into consideration.
Yeah. There's this woman named Deborah Estrin who did this really terrific project called Small Data. And her whole project was she gave a talk I think she gave a TED talk. And in her TED talk, what she said was her father was living at home and the kids were unaware of the fact that he had been eating less, was sleeping more, and was taking smaller and smaller steps to get around the house. And she said all of the data were there that pointed to cognitive decline and, just frailty, but there was no connection of those data back into anything. There was no escalation, like the refrigerator didn't report that it hadn't been opened in 24 hours, and the floor didn't report that his steps were smaller. But the funny thing is we can actually do all of that now. There's people who look at all that, but we mostly don't have it. There was actually a kid who presented at the Google Science Fair a few years ago because his dad had a fall risk. He created a sensor that was in the bed so that whenever his father would get up, his mother would get an alert.
Huh.
So there's way more technology that I'm hoping through digital health we'll be able to bring it all together at some point, because the EHR is super full and nobody has any time for anything. But we as patients and as family members have a lot more tolerance and have a lot more incentives to, to see. I mean, I would love to know what my daughter's doing right now. I do have Find My Friends running so I can watch her, but I can't always tell what she's doing.
But I think that goes back to a little bit of what we talked about previously, is that we can only do with what we know and understand. Right. So if we don't know what some of these values mean in the medical record and know how to track the trends,
right?
Because there's a big difference between LDL and HDL, and we have to make sure that the patient understands that to know what to do with it. I had just had blood work done, and when I was there, my doctor said, I won't be able to review these. You'll get them back in 24 hours, but wait for 48 hours for me to be able to say something to you about them. So I did, and I understood. It was fine, but I know she did a quick review. She checked it off and made sure everything was okay, and then went, on her day. Then it's kind of up to me to decide, like, if I understand it and if I'm going to track it on my own as well. And so it would be nice to be able to give patients a little bit more information so that they can monitor their health information as well.
So I think the theme I'm hearing here is that if Kevon is lucky enough to get this project going, and younger kids who have HIV and who are getting a need from friends to kind of let them update them about their status and their counseling and everything else, if that works, and with these other portal changes, that we'll all be able to rest easy with our portal working the way we want, which is a direct segue into Jane's and Jeannie's lullaby songs. All right, see how I did that?
There we go. There we go.
You guys can't see it, but Jane is losing it on that segue. She thought that was good. I'm so proud of myself.
I'm proud of you too, Kevin. Well, very briefly, Jeanie had come to me and said she wanted to write a lullaby. She had her daughter-in-law gave birth to twins, and twin little girls, and she wanted to write a lullaby about that. And I said, oh my God, this is so weird, because I've been wanting to do this lullaby project. My other friend out in LA, Sandra, had said to me that her son had written a poem and she thought I could look at it and see if I could turn it into or the beginnings of a lullaby. And I thought, the universe is bombarding me with instructions here. And I like to listen to the universe. So I thought, let me see what I can do with this information. And what I did was create this lullaby project, and I would like to turn it into a lullaby app.
Wow.
And there will be an app with these are full songs. Most of them are shorter than normal songs, maybe 2 minutes, 2.5 minutes. And then also have a YouTube channel with just the instrumental versions, so that if someone wants to put the YouTube channel on, they put the kid in the crib, They turn it on, and there's like an hour and a half to 2 hours worth of music on them. So far we have 13, so we're on our 14th song. But Kevin had asked me if I would do one of them, and I'm going to just have a disclaimer here. I'm not a singer, I'm a songwriter. And although I can carry a tune at times, I am
How
going
far?
to go as far as it'll take me, Kevin. Let me just pull the lyric up to this. I don't think I need it, but just in case. I know, but you never know. It's fairly new.
And for people who, I have to say,
So,
while you're bringing up the lyric, this is the other thing that just amazes me, because I couldn't tell you half of the conclusions of the papers I've written, and songwriters in town can tell you every lyric of the songs they've written without. I don't even know how you guys remember that stuff.
I've been doing it for 40 years, and I've written a lot of songs,
Yeah.
and I had an interesting thing happen recently. Well, actually, it was just a very few years ago. Um, the first country song that I ever wrote, because I'm born and raised in New York City. We didn't even have a country station. But when I moved down here, I got a publishing deal fairly quickly. And one day my publisher said to me, Jane, we love the songs that you're turning in, but they're not country, and we're in Nashville, and you need to start writing country music. So I wrote a song, and it actually ended up being my first cut, what we call a cut, my first recording. And it was recorded by an artist named Tammy Wynette. And I was like, Tammy Wynette was like legendary,
Yeah.
and I was like, where do you go from here, But I don't even
To
remember
lullaby
how.
songs.
Thank you.
Yeah.
So anyway, you know what? I'm gonna just do this song. Kevin asked me to do a song, so I'm gonna do it. Oh no, I'm sorry. So this song was written. I think I wrote it about 39 years ago.
Oh.
And yeah, at this point, not this one, the Tammy Wynette song. And I started performing it out in when I would play in writers' rounds. I'd say, hey, I'm going to do this song that Tammy Wynette recorded. It's a fun little ditty. And it had been 39 years. I remembered every word of the first verse, and I remembered every word of the chorus, and of the bridge, and of the chorus, and out, and I was a happy camper. And I played it like that for about a year and a half. And then one day, a friend of mine said, I pulled up the Tammy Wynette song on YouTube because I never heard her sing it. And it's got another verse. And I went to YouTube. I had completely forgotten about the second verse, and it's a good verse.
Wow, who wrote that? Oh, I did.
Hey, wait a minute, I did. It was so bizarre. I'm sorry. I digress all the time. All
That
right,
makes me feel better.
yeah, really. Okay, let me just pull out the lyric. So when Jeannie and I wrote this particular song, it was right after. Well, I can tell you, May 11th is when we wrote it. I'm looking at the lyric sheet, May 11th, and it was right fairly at the beginning of the Ukraine conflict. And as I was doing, playing, coming up with the music and whatever, it just hit me that I felt like we were writing it for the children of Ukraine.
Oh, wow.
It could be for any child, but the name of the song is Peace Child. And it's, I don't know, hopefully you can hear me. Peace, child, I wish you peace. Like a still summer night with the stars twinkling bright. Sweet peace, child, in your dreams drift away to that happy place where you can sleep in peace, child. If I could, I would stop the rain from falling. The sky would always be blue, and everything you touch would be golden, and every heart you meet would be true. But most of all, I wish you peace, child. I wish you peace. Like a still summer night, with the stars twinkling bright. Sweet peace, child. In your dreams drift away to that happy place where you can sleep in peace, child. Angels watching over you, taking special care to cover you with love and hold you in their prayers for peace, child. Ooh, like a still summer night, with the stars twinkling bright. Sweet peace, child. In your dreams drift away to that happy place where you can sleep in peace, child. Peace, child. Peace, child. Anyway, we have recorded that, so not me singing, obviously.
Well, that was beautiful. You know, it's a great, I have to say, not only is it a great melody, but it's a complicated rhythm.
Oh, it's a little bizarre. I tend to be a little left of center in everything I do, so.
Yay, we love that about you. Kevon, you were into that, I could tell.
Yes.
Oh, good. I'm so glad.
Yeah, I love the different musical pieces to it. Beautiful song, beautiful lyrics.
Mm-hmm.
Yeah, very touching. Was
Thank
the bridge, the angels watching over you, was that a bridge?
Yes, that is the
Okay. Okay, that's what I thought.
that is the bridge. I tend to do my bridges tend to be a little definitely left of center. Jeannie always says to me, "Where do you come up with these chord changes? It's like totally alien to anything that should be there." You know,
But it works. Yeah.
It works.
I have to say this, listening to the lyrics, I was trying to enjoy the lyrics, but I kept having this visual of this being in front of Kyiv. Like I can just see the background to the music video.
I've already got We Are the World. Trust me. I mean, I hear big, oh yeah. I hear 30, 40, 50 voices on this thing. Totally.
There you go.
Yeah,
Well, maybe we should,
I get on my little lullaby app.
Well, I think the app idea is really interesting. So we'll have to see if other people agree. She's got an in to a big time app person who's going to help put it together.
Well, he doesn't know he's helping yet. I haven't told him, but I know that.
Hey, what's his name? We'll put it in the podcast, and then you can send him the podcast. Oh my God! Was your name in there? There's like 5,000 people who listen to it, so you don't have to say yes. Yeah. Okay. Well, so first of all, Kevon, thank you so much for going through and kind of, stimulating a conversation that we had about portals based on the work you're doing. And then thank you, Jane and Jeannie. Thank you so much for coming and doing a little harmony back there. I heard you back there doing that harmony. It was so nice.
Yeah.
Yes.
Thank you for asking me, Kevin. I love doing these. I just think they're so interesting.
Well, yeah, I do
Obvious,
too.
totally out of what I normally do. So this is fabulous.
And you say that you're not a storyteller, but you tell some pretty good stories. Sarah, thanks for coming.
As always.
Thanks again to our guests, Kevon Jackman and Jeanie McQuinn, for joining Sarah Bland, Jane Bach, and me in that discussion. There's a lot more to be done with the patient portal, as you heard, but it's come a long way, kind of like everything else that we're witnessing in informatics in this millennium. Thank you all for listening. By the way, we've got some great topics queued up, so please stay tuned. And finally, I want to thank Jane and her team for producing that wonderful lullaby and thinking about the times we're in globally as they produced it. Lots of people need help right now, and I hope her project gives all of them peace. Be well.
Peace, child, I wish you peace, like a still summer night, with the stars twinkling bright. Sweet peace, child, in your dreams drift away to that happy place where you can sleep in peace, child. If I could, I would stop the rain from falling. The sky would always be blue. Everything you touch would be golden, and every heart you meet would be true. But most of all, I wish you peace, child. I wish you peace, like a still summer night, with the stars twinkling bright. Sweet peace, child, in your dreams drift away to that happy place where you can sleep in peace, child. Angels are watching over you, taking special care to cover you with love and hold you in their prayers for peace, child. Like a still summer night, with the stars twinkling bright. Sweet peace, child, in your dreams drift away to that happy place where you can sleep in peace, child. Peace, child. Peace, child.